Hello, I'm Sonia Thompson, a palliative care nurse with the specialist palliative care team here at Sunderland Royal Hospital.
And I'm Dr. Jonathan Pickard, a consultant in palliative medicine working with the team. We're going to talk to you about what is meant by palliative and how we work as a specialist team in the hospital and beyond. The term palliative is used to describe when a condition is not curable and is expected in time to be life-limiting. This doesn't just apply to cancer, but to other serious illnesses as well.
Palliative care is an approach that improves quality of life for people and their families when they are facing problems associated with life-threatening illness. It's relevant when a cure just isn't possible.
It may sound scary, but it's also hugely important. As cancer treatments get better, palliative care helps more people live as well as they can, for as long as they can. When people eventually reach the end of their life, it's about doing all we can to support their comfort and dignity, whilst respecting their values, preferences, and beliefs. Palliative care is certainly not about giving up, nor does it simply mean end-of-life care. It's about so much more than that.
The palliative care approach doesn't just look at physical problems like shortness of breath. It looks at people as a whole, including their psychological, social and spiritual needs. Simply put, their mood, emotions, home situation and the things that are most important to them, alongside the physical problems which may cause by the illness. It's what we call a holistic approach, not just for the individual person, but also for those close to them, like their families and their friends. Good palliative care should be available to everyone who needs it and can be delivered anywhere in the hospital or community. This can involve things like helping with symptoms relating to disease or treatments, such as pain or nausea, or encouraging people to talk about the difficult things, like where they'd like to be looked after at different points in their cancer journey.
When people reach the very end of their lives, being in hospital can take people away from the things that matter, like being at home amongst loved ones. All healthcare professionals are expected to help the people they look after consider what's most important to them and help to plan their healthcare in a way that suits who they are.
As well as this, all healthcare professionals are expected to do simple things to help improve the quality of life and provide comfort for those people too. Sometimes that requires a little more support from our specialist team when cases are complicated, or on those rare occasions when symptoms may become a little bit more tricky to address. Our team doesn't see everyone with a palliative diagnosis, nor are we involved with every person reaching the end of their life. But as specialist palliative care, we help support those in the most challenging of situations, whether that's because of physical, psychological, social or spiritual problems, or a combination of all of these.
Our hospital team's made up of other specialist nurses like Sonia, other doctors like myself, and a specialist clinical pharmacist. We visit patients on the hospital wards, working alongside other teams, lending support and advice to oncologists, surgeons, and other doctors, whilst they continue caring for those patients day to day. Many people we are involved with will be receiving active treatments alongside our input, like chemotherapy, radiotherapy, and surgery. Seeing the specialist palliative care team doesn't stop that, and it can even help make such treatments easier to receive. But we're also there to provide help in those situations when there are no more treatments for a cancer, or when treatments can't be given because they may do more harm than good. We might advise on the use of different medicines to help with troublesome symptoms, or help people to navigate the uncertainty and anxiety that can accompany a cancer diagnosis. We can explore views and choices and help coordinate honest conversations that still keep our patients in control when it might feel like the situation is anything but.
And our hospital team is just one small part of our service. We also have a specialist community team including 7-day, 24-hour community cover for the Sunderland area, which helps people continue to be looked after in their own familiar environment. And there's also the hospice.
St Benedict's Hospice is a haven for holistic care and advanced support, made up of a short-stay specialist ward, outpatient clinics, lymphedema, and day services, which include things like psychology, complementary therapy, counselling, chaplaincy, and more. The hospice and the community services that run from there received a rating of outstanding from the Care Quality Commission. Sometimes hospital patients seen by our specialist team may be referred to the hospice for short periods of more intensive support in a calm and spacious environment.
So palliative care is about maximising quality of life, helping people live in the face of life-limiting illness, and making sure that when people naturally reach the end of their lives, they are free from distress or symptoms wherever possible. When a cure cannot be found, palliative care is important at all stages of the cancer journey.
It's about promoting choice, planning care in advance, considering your values, beliefs, and preferences, and combining that with open, honest conversations about the future. Every healthcare setting should be able to deliver this essential level of palliative care. But for those times when things become even more challenging, we can step in as a specialist team to support you and those important to you. We work alongside the ward teams, lending our expertise to situations in a caring, compassionate, and holistic way that keeps you at the centre of care. Thank you for listening. If you have any concerns or questions, please contact your cancer nurse specialist and they will be happy to assist you. Thank you.